As you know, the safety of endometrium during MRgHIFU ablation for uterine fibroid is very important in terms of the preservation of future fertility. However, there could be a controversy, especially when treating submucosal fibroid. Close proximity to target may threaten the safety. However, different tissue may have different thermal tolerances, and MR thermometry can raise the safety level. There has been no study that specifically evaluates the endometrial integrity after MRgHIFU ablation. So the purposes of our study were to retrospectively evaluate the endometrium integrity after MRgHIFU ablation for submucosal fibroid based on MR finding and to elucidate the risk factor for injury. Study period was like this, and we analyzed the 117 submucosal fibroids retrospectively. In D280 image, we assessed the degree of fibroid protrusion into the endometrium and T2 signal intensity ratio relative to skeletal muscle, and assessed the relative peak enhancement in perfusion MRI. We used Philips Sonalip system and under MR thermometric monitoring. We checked whether endometrium was included in lethal thermal dose contour, and if noted, we stopped the sonication. When placing the treatment cell, peripheral cells were located as close as to the fibroid margin to cover the whole fibroid, but not to include endometrium. Endometrial injury was assessed in contrast-enhanced T180 image of immediate 3 months and 12 months follow-up based on consensus of 2 authors. Grade 0 injury, grade 0 means normal endometrium. Grade 1 means pinpoint discontinuity of endometrium. Grade 3 means full thickness discontinuity over 1 centimeter in size, and grade 2 meant between 1 and 3. We analyzed the following potential risk factors and performed the univariable and multivariable analysis. As you can see, the degree of endometrial protrusion of fibroid varies, and the involved endometrium was verified to be intact before treatment in all cases. Average acoustic power used was 146 watts, and average MPV ratio was 83%. Complication rate was 15%, which are all minor in severity. This is the main result. At immediate follow-up MR, grade 0, which means normal endometrium, was seen in 56%, grade 1 in 25%, grade 2 in 14%, and grade 3 was seen in 5%. So as you can see, most of the cases showed normal or just a minimal injury. This is the follow-up result, and as you can see, there is a general improvement pattern, except in a few cases. Although the follow-up rate was not very high, there is a tendency of gradual improvement of endometrial injury over time. In univariable analysis, these 3 factors were significant, and multivariable analysis was actually performed twice in order to use as many data as possible, because there was missing value in some field due to hormone therapy. In both multivariable analysis, this factor, degree of protrusion, was proved to be the only significant factor. I will show to you 2 cases. You can see the fibroid is protruded into the endometrium cavity, and the fibroid was ablated completely. And immediate follow-up, you can see the grade 3 injury, and after 3 months, the fibroid shrank quite much, but there was still grade 3 injury, and after 1 year, fibroid almost disappeared, and the endometrium recovered to normal. In this case, immediately after treatment, there was pinpoint injury of the endometrium, and after 3 months, for unknown reason, it was aggravated to grade 2, and further follow-up was not performed. So, in conclusion, after MRgHIFU ablation of uterine fibroid, endometrium is preserved intact or minimally injured in most of the cases based on MR finding. And the injured endometrium, which is more commonly seen after treating endometrially protruded fibroid, usually recovers spontaneously. Thank you.
Are there any questions? I have a question. With any of these patients, did you want to put them on any prophylactic antibiotics if you saw that there was a lot of continuity with the endometrium after the procedure?
Actually, we give patient the prophylactic antibiotic before treatment routinely, so we do not add additional the antibiotics.
So with any submucosal fibroid, you give prophylactic antibiotics, or any fibroid?
For all fibroid.
For all fibroids?
Yes.
Okay. And do you have any pregnancy data, or any of these patients have
actually,
become pregnant since
yeah,
then?
we have in this patient group, before treatment, 9 patients wanted pregnancy, but finally no patients turned out to be pregnant at the time of the study.
Oh.
So I don't know whether they tried or not. Just it's a retrospective study, and I just reviewed that data.
Okay, okay, great.
Did your patients try to expel the fibroid? Did you have any that developed chronic drainage after treating submucosal fibroids?
Do you mean expulsion? There was no case of expulsion in our population.